What's going on? Today we're going to talk about crystalloid IV solutions. Before we get diving into the topic and start talking too much, I want to make you aware that we do have a cheat sheet that covers this. It's over at nrsng.com/IV fluids. That's nrsng.com/IV fluids. So let's talk really quickly. What's the difference between a crystalloid solution and a colloid solution? I know you're going to be presented with that as you're on the clinical floor in your classes and everything. Colloid versus crystalloid, what's the difference? A really simple way to think about it is that crystalloid solutions have much smaller particles. They're able to cross the vascular space and get into the extravascular space, where colloid solution have much thicker particles, much bigger particles, so they're not really able to cross that vascular space and get out into the extravascular space. So think crystalloids have really tiny crystallized type particles, where colloids have much larger particles. An example of a colloid would be like albumin or hetastarch. So they have these large particles that don't really cross that vascular space, where crystalloids have much smaller particles. And we'll talk about crystalloids quite a bit more here. But that's what I want you to keep in mind. That's kind of the difference between the two. Okay. So I just gave a couple examples for a colloid. Would be albumin or hetastarch or something like that, where crystalloids, we'll talk about some of these examples. I also want to talk about a couple of things that you need to keep in mind as you talk about different IV fluids. First of all, you need to talk about the content. What's exactly in the IV fluid? What are the concentrations of different things within that fluid? Then you can talk about the tonicity, the isotonic, hypertonic, hypotonic. And to talk about that, you need to talk about the osmolality. Okay, osmolality basically talks really kind of about the concentration of particles within a solution. When we talk about osmolality, it's important to know that the blood has an osmolality of about 300. Okay, so anything that has an osmolality higher than the 300 or so is going to be hypertonic. Anything that has a osmolality below that 300 or so is going to be hypotonic. And anything that has an osmolality right around 300 is going to be isotonic. Now, if we give this fluid into the bloodstream, okay, so we have our vascular system, we put an isotonic fluid into that bloodstream. Fluids aren't going to be drawn to it or want to leave it because it has the same osmolality of the blood. If we give a hypertonic solution, okay, something that has a higher concentration of particles than the blood into that bloodstream, what's going to happen is fluids are going to try to move to it. Okay, and that's when we're talking about osmolality and osmotic pressure. Get is that we're going to be putting all this concentration of particles into the bloodstream that has a higher concentration. Okay, it's hypertonic to the bloodstream, and so fluid from other areas are going to try to get to it to balance out that osmolality. Okay, to try to balance out the concentration of these solutes. Then if we put a bunch of hypotonic fluid into there and we dilute, okay, the system, some of that fluid is going to try to leave and go to a place where there's higher concentration of particles. So that's kind of how that works. That's that osmotic pressure that we're talking about. The fluid wants to go from an area of low concentration of solute to an area of high concentration of solute. So it wants to even out the distribution of fluid to solute. Okay, solute are all these little particles, the sodium, all these electrolytes, the glucose, and the different things that create this tonicity and this osmotic pressure of our fluid. So hypertonic fluid really essentially just means that we have a higher concentration of particles in our fluid, where hypotonic means we have a lower concentration. And our blood is about 300, has an osmolality of about 300. So something that's right around 300 is isotonic. It's not going to cause any adjustment or change in fluid movement. Something that's hypertonic has a much higher concentration of solute. And so fluid from outside areas is going to try to come into there to try to balance out the concentration of this solute, of these particles. Something that has an osmolality much lower than 300 is going to be called hypotonic. All right. And so fluid from outside spaces is going to try to come, or so fluid from inside that vascular space is going to be open to leave and cleaning to try to balance out that osmolality. So some of our most popular crystalloid IV solutions, let's talk about them. One of them is D5W. That's the way you say it, D5W. This has glucose included with it, and so it has an osmolality of 252, and it's considered an isotonic fluid. Some of the reasons we give it are to treat conditions like hypernatremia, and it can also be used with the administration of some medications. Some medications come with distilled in D5W. Another common crystalloid IV solution is half NS. Okay, it's 0.45% saline, and then it also has sodium and chloride in it. The osmolality of this is 154, so that makes it a hypotonic fluid. Some of the reasons we would give this fluid is it's a maintenance solution, but it doesn't replace our daily electrolytes. So it can be given to replace hypotonic fluid loss. And one thing to watch out with this is because it's hypotonic, that it can cause intravascular fluid overload if it's infused too quickly. All right, so if we're giving all of this and we're diluting our serum, then we can actually cause this intravascular fluid overload by doing so. The most popular IV fluid, crystalloid IV solution that you're probably going to give is going to be normal saline. It's 0.9% saline, and then it also has some sodium and chloride in it, but it does not have any calories like your D5W, your D10W, and your solutions like that. The osmolality of normal saline is 308, making it obviously isotonic. It has a lot of uses. It's really kind of a lot of physicians and providers go to maintenance fluid. It can be used for post-operative fluid. It helps to increase intravascular fluid and replace extracellular fluid losses. But it has a little bit higher level of sodium and chloride than your regular blood level. An important concept to keep in mind is that normal saline is the only solution that we administer with blood. Anytime we're giving blood products, normal saline is going to be what we administer with it. Another crystalloid you need to be familiar with is 3% normal saline. This has a very significant amount of saline in it. It's 3%, and it has a high level of sodium and chloride in it. This is a very hypertonic solution with an osmolality of about 1,000. Okay, so remember, that makes it very hypertonic. What's going to happen with this hypertonic fluid? As we put that 3% saline in there, what it's going to do is it's going to pull extravascular fluid into the bloodstream. So one of the reasons we give this is actually for conditions like cerebral edema. A lot of times, first-line defense or something that physicians will order for a patient who has cerebral edema is they'll give them 3% normal saline, hoping to pull some of that edema, some of that cerebral edema, and get some of that fluid that's surrounding the brain out and into the bloodstream and get rid of it. This can also be given to treat hyponatremia. You have a patient with, 120 sodium level, we can give them 3% normal saline to try to increase their sodium level. Another popular fluid is D5 half NS. D5 half NS has an osmolality of 406, making it hypertonic. It has the half normal saline in it, or half saline in it, which is the 0.45% saline. It also has some glucose, providing some calories in it, but then it also has a small amount of sodium and chloride. So this can be given as a maintenance solution, but it doesn't replace other daily electrolytes. Okay, it will give some sodium and chloride, but it's not going to really replace our daily electrolytes. Now remember, it's hypertonic, so it can cause intravascular fluid overload if it's infused really quickly, because it can draw the fluid from the extravascular space into the intravascular space. And so we really need to watch that. We need to watch fluid shifts in our patients when they're receiving a fluid like D5 half NS. So I know that's a really quick overview of some of these crystalloid IV solutions, but the main terms I want you to keep in mind is the basic difference between crystalloid and colloid. Remember, colloid has these larger particles that aren't going to be able to diffuse across the vascular space, where crystalloids don't. And then it's important to keep in mind what osmolality is. Osmolality is going to refer to the concentration of particles within our solution, which makes up our tonicity, which is going to be the hypertonic, hypotonic, isotonic, and that really is going to refer to it how closely is it with our blood. Okay, how close is it to about 300, 290, 300, something like that? That is the osmolality of our blood. If it's greater than 300, it's going to be hypertonic, and it's going to want to pull water to it. If it's less than 300, it's going to be hypotonic. It's going to be willing to lose some of that fluid. And if it's around 300, it's going to be isotonic, and it's not going to really participate in those fluid shifts. All right, so that's Crystalloid IV solutions. Remember, you can go to nrsng.com/IV fluids. You can get a little one-page sheet that talks about some of these most popular Crystalloid IV solutions, what's contained in them, the osmolality, and then the uses.